All right, so the next question says, I feel physically ill. I can't think straight and really feel like I'm in a fog. Sometimes I even feel like I can't breathe. How am I going to get through this? What can I do?
Physically ill, can't think straight, feel like you're in a fog. I mean, I hate to repeat myself, but again, as a clinical psychologist, the first thing I would want is a medical evaluation. The person could be just experiencing a lot of depression, a lot of anxiety to the point where it's acting and affecting their body. And I certainly would want to explore that possibility. But before I could explore it, if a person's physically ill and says that they're in a fog, I want to make sure that they get a neurology exam first, actually. So my first step would be the doctor, like a medical doctor. And if that shows that the person is fine, then I would maybe want to take a slightly different approach since they seem to be tying all this back to their body. So when we feel physically ill, we oftentimes want to take some quiet time to lie down and to rest, to take a hot bath, which is great. So I would encourage the person to do that. And then because they're also saying that their mind is in a fog and they're feeling physically slow, what better time than to journal so that we can start to trace and track some of what is on their mind, because the person can't even really get help until they can start pulling their thoughts together a little bit. So I would encourage some quiet rest and journaling.